Welcome, everyone, to the La Jolla Cosmetic Podcast. I'm your hostess, Monique Ramsey. Today, I have a really fun topic to explore. It's about threads and thread lifts and how we can use threads in lots of different places in the body to lift and, create more collagen. So I have Khanh Nguyen with us today. Welcome, Khanh.
Hey, good to see you, Monique.
Good to see you. Better known as Dr. Khanh. Everybody's like, oh, Dr. Khanh, I love Dr. Khanh. So Khanh is the thread doctor, the thread specialist in the office. And, you're widely known, Khanh, for doing all kinds of great things with injectables and lasers. But I think, you're the king of thread lifts. Would you allow us to grant you that title?
Sure, I'll let you say. I'll just say I've been doing it the longest. So the senior citizen of threads. How about that?
So let's talk about what a thread lift is and what makes the procedure special. Tell me a little bit about threads. What can we picture as what they look like?
Yeah, so threads for me, I think it builds a bridge between a medical spa and then a surgical center. So not many things outside of surgery will help lift skin. Now in med spa arena, we have Botox for wrinkles, we have fillers for volume, and highly debated subject, do fillers lift, which we can talk about another time. But at a certain point, you'll have too much fillers in your face, or you're just the type of person who doesn't want fillers in your face. But you still need to reverse the signs of aging. Aging is going forward, aging is falling down. So now we can take threads and actually physically lift your face, physically lift your body, physically lift your neck, different areas of the body. So that's why I believe it's that bridge between a medical spa arena and a surgical, because not that many things lift. And that's where threads are mostly used for, is lifting of the skin. And like you said, really building collagen.
So how do you know when you've reached the point, let's say you're using fillers and you don't know if you're reaching the point where fillers just aren't doing the trick anymore? How do you know when you're is the threads going to come in after fillers or in conjunction with? And then how would I know when it might be time for a facelift?
Sure. Great question. And I might be divulging a bunch of secrets here. But when you see me in office, or even when we do Zoom consultations, my hands represent fillers. My hands represent threads. So I can actually physically show you one side of your face, what it will look like with fillers, the other side of your face, what it will look like with threads. So with fillers, you're replacing volume. So as we age, we lose bone, fat, collagen, and muscle. So we're losing a bunch of volume systems in our face. The only thing that will replace volume is volume, so fillers. But let's just say you're at an age where your skin is very thin. And if you don't like fillers, or you're already volumized to the point where you're happy, but now how do we lift the rest of that skin? That's where PDO threads comes in. Now, we all do this trick at home in the mirror. When we look at ourselves in the bathroom, what do? We take our face, we put our finger on our skin, and we do this.
Yeah.
Bingo. So I'm like, one day it came to me. I'm like, this is how I'll represent threads to people. If you take your finger, one solo finger, and you put it anywhere on your body, eyebrows, cheek, jawline, and you give yourself a nice little one finger lift without causing any amount of skin bulging in the back of your finger, that's how you look with PDO threads. So if that makes you happy, PDO threads is a great option. Now, if you have to take your whole hand, you have to take multiple fingers, or if you're pushing so hard that you have a mound of skin behind your hands, that's when you go see a surgery center. That's a quick way to represent PDO threads versus your surgical result.
Okay. And filler, how do you figure out what filler might look like before you have the filler?
Yeah, similar situation. Let's just say we have generally 3 hollows in our face. We have temple hollows, we have mid-face hollow, and we have lower face hollow. So when we start hollowing, that's when skin begins to sag, descend, and we look a little bit older. So how do I represent volume? So if you take your temples, if I had a hollow temple right here, take your hands. Now, instead of lifting, you want to pinch that skin to create a mound. Oh. That's replacing volume. Let's pretend that you had this tear trough, this mid-face hollow. If you push the skin on your cheek up to create this volume, that's how you represent fillers. So that's how I generally represent fillers versus lifting with threads to patients.
Perfect. That was so educational. Thank you. I'm now going to be after this thing. I'm going to be like, all of us are going to be using our fingers and figuring out like what we need. So when you said PDO threads, so what does that mean? What is PDO?
Yeah, so a little history behind it. So PDO stands for polydioxanone. That's just the chemical makeup of the thread. Now, much like fillers, where you have brands like Juvederm and Restylane, they all make HA fillers. So think of PDO as equivalent to saying a hyaluronic acid filler. Now, here at La Jolla, we specifically use NovaThreads and maybe a couple other threads if I need something specifically. But the history behind that is surgical sutures. Your whole family is surgeons. What happens in the 1970s for cardiothoracic and orthopedic surgeons, they needed a suture where if they sewed up a patient, it would dissolve over time because you don't want any foreign implants in the body that may cause issues. So now in the late 90s, early 2000s, we're like, hey, can we use this dissolvable suture to actually lift skin? There's a little bit more history behind that, but the medical history behind it has been around since the 1970s. But now we can take that dissolvable suture and lift skin. More importantly, build that collagen that we've lost over time.
So because you can get a little bit of lift, could it be postpone the need for a facelift? Or I guess, yeah, is it going to postpone the need? Does it help make it be like, oh, that's 5 years down the line now because I had threads? Or is it more of a temporary fix?
It can do a lot of things. Let's just take the patient who isn't medically qualified for surgery, isn't financially ready for surgery, or they don't feel like surgery they don't need that much of a lift yet. They're in that middle ground. So PDO threads is, again, that great bridge to give you that one finger gentle lift. Because it builds collagen, because it's also improving your skin and quality over time. Can it postpone surgery? Absolutely. But it can also prep you for better surgery in the future. Because if you have better skin, better tissue quality, the surgeon can potentially pull tighter, lift harder, things like that.
Oh, I like that. I didn't know about that. And then for somebody who's already had, like me, I had a facelift a long time ago. So, and I've had threads. I mean, to me, it's kind of a wonderful adjunct after when you're like, okay, I have some laxity again. And how do I take care of that without another surgery?
Bingo. So threads can be the ultimate fix. However, it can also fine tune. So some of the surgeons who have actually done the surgeries, and let's just say they were unable to grab everything that the patient needed due to a multitude of issues, right? Let's just say we weren't able to grab all the jowl, all the nasal labia, or the smile line. After the patient's fully recovered, the surgeon will actually send them up to me and be like, hey, can we grab the rest of this jowl? Can we grab the rest of the smile line? Because the last thing a surgeon wants to do is put a patient under anesthesia again, just to fine tune these little things. So now this is where threads comes in. I can actually physically grab that area where we want to lift it up. And now hopefully the patient's at 100% improvement now, even after surgery.
That's wonderful because I think that's the one thing with facelifts that people really are scared of is that looking too tight, too pulled. And you're right. If they pull a little bit more, it could end up looking unnatural. Whereas wait and see how everything settles and then maybe fine tune with the threads. That's really, I never knew that I knew I did it after having a facelift much later. It's been a long time. I was 37 when I did it, and I'm 55. So, it's been a long time, almost 20 years. But for the people who would you wait? Let's say the patient would be how far post-op from a facelift to be able to have you fine tune?
I would leave that up to personally your surgeon. That's always the most important thing. If you aren't a part of our surgery center, then I always say, hey, go to your surgeon, make sure you're qualified, and then we can address it as well. Actually, this brings up a good point. I had a patient in their mid-30s who had a facelift. And it was, I think, within 6 to 12 months, I can't remember. But the first thing I said is, hey, go to your surgeon, make sure you're qualified for threads, because the last thing I want to do is make any damage that's long-lasting. So speak to your surgeon, make sure it's okay, and then we can do threads anytime I give that clearance. I think our surgery center, I think it's usually after 3 to 6 months. And that's usually my personal rule is 3 to 6 months outside of surgery, just to make sure you're fully healed. And hey, maybe in 6 months, everything that you thought you needed to correct will correct itself.
That's true. That's true. A lot of things do resolve on their own. And, you have swelling, even if you don't even really realize it, I think over time. Now, speaking of swelling, so is that something that you end up when you're doing, let's say we're doing threads in the face, does that cause trauma or swelling, or what's sort of do people have to worry about if they went out to dinner that night or the next day? What are your tips for kind of managing your post-op?
Yeah. So I know threads are relatively new to the San Diego area, especially when I brought it here 4 or 5 years ago. Everyone was like, you want to put a string in my face? So I want to break this down as easily as possible for people. Everything that you associate with fillers, you can associate with threads. If I'm doing a filler, I'm taking a needle and I'm putting in a filler. With threads, I'm taking a needle and I'm putting in a thread. So every single thing that you associate with post-care or pre-care, things like that with fillers and threads, analogous with each other. Now with threads, can you get swelling? Yes, you can with fillers. Is there a downtime? Absolutely. If I bruise and swell you, it would just be normal downtime. But fortunately at La Jolla, we have a laser that gets rid of bruising and swelling. But then lastly, a lot of the swelling that you actually get from threads is not from the thread procedure itself. It's from the lidocaine I put in. So I can make you as comfortable as possible where you feel absolutely nothing, or you're like, hey, I have to be somewhere in 24, 48 hours. I don't want to be swollen. So we can limit how much lidocaine we put in you. So it's actually not the procedure that makes you swollen. Unlike fillers, fillers naturally makes you swollen by nature, but threads doesn't. It doesn't pull in water. So a lot of the swelling that you do get, it's just from the lidocaine itself.
Interesting. So now of these threads, I've seen you hold them and there's different kinds. So you're talking about it being suture, but kind of if you could walk us through what are the different types of threads and what you use them for.
Yeah, in America, we have 3 different types of chemical makeup when it comes to threads. We have PDO, we have PCL, and we have PLLA. PCL and PLLA produce more collagen. They're more biostimulators. They're similar to what Sculptra is. Mm-hmm. Now, PDO is more dissolvable over 4 to 6 months. So because it doesn't last as long, I like it because there's less complications. Something that lasts longer in your body, granted, we want longevity, but anything that lasts longer, the complications last longer. So if you create a lump or bump, you're going to create a longer lump or bump. And then PDOs for me, I think are stronger. So that's why I use PDO threads. They less complications and they're stronger by nature. Now within PDO threads, this will distinguish coming to me, coming to La Jolla versus coming to other places. I use all different types of threads. I want to lift you. So these are the barbs, also known as molded, also known as cogs, multiple terminology for it. But what they are is they're little porcupine tails, thin threads, and I can actually physically lift your face. So that's that one finger. Anywhere where we want to lift skin, that's where we're using the barbs. Now we have 2 other types of threads. We have smooths, which look like little pieces of dental floss. And then we have twists that look like little slinkies. Now I'm probably aging myself by saying slinkies, but this is how we complete the treatment for you. We don't want to just lift you because this is what happens. I lift you, you look great. 2 months down the line, you're like, where did all my results go? So I want to make sure I stimulate enough collagen so your body looks better, and better all the way up to the 6-month mark. You will look a certain way when we first treat you. You will look your absolute best in 6 months because you're stimulating more collagen, you're lifting, and you're more tightening. So that's how we treat it here. We use barbs, we use smooths, and we use twists to complete the full treatment when it comes to your face, neck, or body.
And do you think that that could be why, like I've gone to different websites and sometimes people are like, I got threads and they didn't do anything. Do you think that's kind of why maybe that the approach isn't a full treatment?
Absolutely. Just like fillers, just like Botox, just like anything in surgery and medicine, right? If you don't choose the right treatment and you don't choose the right dosing, you don't get the complete treatment. So if you do surgery and you need a full face and neck, but all you paid for was lower face and neck, you're not getting the full treatment. Mm-hmm. With PDO threads, I am more of the Asian and European style of treatment, where my treatment entails a lot of threads and a multitude of treatments. When I go train other facilities, I'll ask them, how do you treat a patient? Or I'll see how people get treated, and I'll also ask them how many threads they use, because most people, they'll just lift you, and then they'll send you on your way. Well, lifting only fixes the issue in the moment and within a couple months after the threads dissolve. If I haven't stimulated that collagen, nothing has happened. You're not getting better. You're not looking better. You're not stimulating that tight skin. One of the analogies I commonly mention is it's like going to the gym, right? You may have the trainer who trains you for that one day. You feel absolutely great. But if you don't constantly train, you're not going to look better. You're not going to feel better. You're not going to be healthier. That's why it's not just the threads, but how many we use and how we place it. That makes the biggest difference.
So during the procedure, you talked about having lidocaine which is to numb the face, right? So what do most people feel during the treatment?
If you can get through Botox, you can get through threads. If you can get through fillers, you can get through threads. But now it'll harken back to who is your provider. For anyone who's got Botox from multiple providers, for anyone who's gotten filler from multiple providers, you'll know that provider makes the difference on how much pain tolerance you need to deal with. Now with threads, and this is actually funny that you asked me this week, because last week on Thursday in Carlsbad, I had 2 patients back to back, brand new thread patients, and they were told this is going to be the worst pain you've ever had in their life. Even from her provider friend who does all her treatments for her, she's like, this is going to be pretty unbearable for you. And I love hearing that. Like, I honestly love hearing that, because there's just an utter shock when we finish the procedure. They're like, you're done? That was it? It's no big deal? Because it's how I numb you. It's how I know how to do it. So here's the thing with threads. If I'm in the wrong place, it's going to hurt. If it hurts, you're not supposed to bear through any pain. You're supposed to tell me, hey, that's a little uncomfortable, Khanh. At that point, I need to decide, does this patient just need more numbing because they just are having issues with pain, or am I in the wrong place? If I'm in the wrong place, I need to adjust, just like fillers, just like Botox, things like that. So your body always reflects if I'm doing the procedure correctly, but no, it should not be painful.
Okay. That's good to know. and that sort of, now we've been talking about the face, but you and I talked on a podcast way back when I think we were talking about cellulite, and we were talking about how threads can sometimes help in other places of the body. So tell me where else you like to use threads.
I've used threads from hairline all the way down to kneecaps, because unlike the face where you can put in Botox, fillers, lasers, do a bunch of procedures to help improve that area, from the neck down, I consider the body. And from the neck down, you don't have much. All you have is collagen. So unless you have a ton of laxity and you go to a surgical center to have surgery, there's not many procedures that are, 1, going to lift the area, 2, stimulate collagen, and 3, improve the texture. So again, if you take that one finger and you put it anywhere on your body, common places is the neck, the back of the arms where our skin falls on our elbows. So if you lift your skin back there, if you give that one finger lift and it makes you happy, PDO threads. Laxity in the chest. Now, I'll never do a breast lift because most people don't qualify. Because if your breasts are too big and they're heavy, threads can never pick them up.
Yeah.
Now, if you're looking for a breast lift because you have a smaller size breast and you're looking for a perk, again, that's not what it's meant to do. But if you have wrinkles, if you have general laxity, we can pick that up with PDO threads. Abdomen is another big one. So if you've lost a ton of weight, you have laxity over time, and people always say, I work out 24 hours a day and I'm not improving my stomach. Well, It's not a muscle thing, right? It's a laxity thing. It's a collagen thing. And we said not many things pick up other than surgery and threads. Not many things stimulate collagen. And yes, I can use injectables, but for the body, it's too mobile. And the skin's a little bit different for me to use injectables in that area. So that's where, again, PDO threads really bridges that gap and gives me a tool that I can actually improve laxity and lifting of the body.
Mm-hmm. Now, you were mentioning earlier that how your results, you see an immediate lift, but then that collagen building happens over time, and that by 6 months, is that about, no matter where you're putting them, is that sort of the time where you would say, okay, here's my peak result?
Yeah. So as long as the threads are in your body, so on average, it lasts about 4 to 6 months. As long as they're still sitting there, your body's going to wrap neocollagenesis around it, create pseudo scar tissue, good scar tissue. But what you're doing is just creating that lattice. And if you look at some of the research that's come out of Korea, I think there's a couple of research articles out of Europe as well, but most of them are from Korea because Korea's done them the longest. What they'll do is they'll do a cross-section of tissue. They'll put in threads, take out a cross-section. 6 months, you'll see a little hole there where the thread used to be, but now you have this bright ring of new collagen right around where that thread used to be. And that's what we're trying to stimulate. Because fillers puts in volume, but it does nothing for collagen. We want to thicken that upper layer. So if you remember when you pinch a baby's cheek, right, it bounces right back. That's why they look so young and youthful. You pinch the skin of like a 60, 70, 80-year-old person, that skin just sits there. It tense. It stays in place. We're trying to create that bounce back effect. And that's what collagen really is. And that's, I think, one of the common missing keys when it comes to aesthetics. We always want to fill, we always want to fix wrinkles, but we never want to fix that elasticity of the skin. And as long as the threads are sitting there 4 to 6 months, you're going to continue to improve over that time frame.
So you're going to improve over time. How long can people expect to see their result last for?
Yeah, most people, if you treat it appropriately and you're happy on that time frame, I usually don't treat it within a year, year and a half. Okay. Normally, my follow-up time, I time it with your Botox because everyone comes sees me for Botox every 3 or 4 months. Mm-hmm. So we do the threads. If everything goes well, no complications, no issues, I want you to see me in 3 months. Because if you see me anytime sooner than that, you haven't given your body the chance to develop collagen. You haven't developed the chance to stimulate, lift, and tighten more. So come back, see me in 3 months for Botox. At that point, we'll take pictures, we'll evaluate, you'll tell me if we need to do anything further. But let's assume you are absolutely happy. Most people don't treat it within a year and a half.
That's good. Now, I'm assuming there are times where you're going to maybe recommend threads plus something. Like you said, maybe Botox for the dynamic wrinkles, or, what are kind of some common adjunct procedures that you might recommend to a patient?
Yeah, there's a lot of stuff that we can do, right? Lasers, Botox surgeries, all kinds of injectables. Even within injectables, you have hyaluronic acid fillers, you have Bellafill, which is a biostimulant. You have Culp Sculpture, which is also a biostimulant. I try to break it down easily in these 3 steps. To reduce aging, to look better, to look more youthful, what are we going to do? We're going to reduce. So I have 3 R's: reduce, replace, rejuvenate. So what are we going to do? We're going to reduce wrinkles with Botox. We're going to reduce pigment with lasers. Now what are we going to replace? We're going to replace the volume that age has taken away from us. We're going to replace with cheek fillers, temple fillers, lip fillers. And lastly, that last R for me is rejuvenate. This is where threads comes in. We're going to rejuvenate by lifting. We're going to rejuvenate by building that collagen. So if you think of those 3 R's, those are the 3 things that you want to correct to make you look better and more youthful. Reduce, replace, rejuvenate. And then from there, we can pick any numerous procedures from Botox all the way up to lasers, all the way up to surgery. We can help you out with that. But if you think of those 3 things, it will help.
That's so interesting, because really, one thing can really do everything, right? Or at least for most of us. We're trying to tackle a bunch of different things that maybe we want to replace, like you say, the hollow areas, and also get a little lift and some tightening, and maybe, like you say, the texture or age spots or sunspots. So that makes a lot of sense. Now, can you have some of those treatments at the same time, or do you stage them?
I time it all based on the patient. One of the big questions I ask patients is, what's your timeline? What's your goal? So if you're like, hey, I'm new to aesthetics, I really just want to dabble in a couple things, then sure, we're going to build this journey together. I want to see you every couple months for the next 12 to 24 months. But if you have this 60th birthday, and I say this because I have this patient who has their 60th birthday coming up in June, she's like, I want to crank out everything because I want to look my absolute best by June for my 60th birthday. So we can do fillers, Botox, and threads all in one sitting. So we're doing all 3 R's at one time. But then if we need to do lasers to reduce pigment, wrinkles, things like that, we can tack that on as well. So I base all my timeline on you. You tell me how fast you want to go, how slow you want to go. And if there's anything special or the reasons or the motivations behind this, that will all play a role in how fast we do something.
That makes sense. So one of the things that we are I guess, addicted to at La Jolla Cosmetic is reviews. And we've got thousands, we've got over 8,000 now 5-star reviews. And so I found a review from one of your thread+lift patients, Khanh, and they said, Khanh was very patient, informative, and realistic about what I wanted and likely results to help me decide what I wanted to do. During procedure, he made me feel very comfortable, moved with my speed, and took great care to reduce discomfort. He followed up after with an email and also a phone call to make sure I was healing correctly and happy with the treatments. So that's a nice little bit of feedback. But I think what it really shows is that your care for your patients is going beyond that treatment day, that it's, you're checking in with them and making sure things are going according to plan.
Yeah, because no matter how easily I explain something, no matter how long a procedure's been around, it has to make sense to you. So I can say it's been around since 1970, but to you, you just heard about it on Netflix 2 weeks ago. I can say I've been doing this for 5 years, but to you, it's a brand new procedure. So comfort is key. Having you feel safe is key. And then going at your speed is key. Because if I just go in there and hammer it out, you may look fantastic, but you may not be comfortable in that setting as well. So it's all about comfort and safety. I think that harks down all the way down to our original CEO, Marie, where she always mentioned that comfort and safety are like two of her biggest words.
Right. Because I think that is true. It's like you've done it time and time again. Some of us are sitting in that chair for the very first time and we're not sure what to expect. And is it going to hurt? And you have all this stuff in your head. So, and I think it's nice when, and really all of our providers are so good at kind of explaining what's happening as you're doing it, because that, at least for me as a patient, that it makes me feel better. It's just like, okay, that's what he's, what's happening now. And I think you're really, really great at that. And that helps with that feeling of comfort and safety. So I know that I took your picture a few years ago with some awards from your thread lifting skills. What was that all about? I don't remember.
We've had it for a couple years now. So 2020, La Jolla was awarded #1 NovaThread practice in San Diego. I was awarded that as well as a personal provider. 21 and 22, same thing. La Jolla was awarded #1 NovaThreads in San Diego. And then for myself, I've had a couple other awards, but I'll just leave that private. But for San Diego and La Jolla, 20, 21, 22, so 3 years running, we're the #1 practice for NovaThreads.
That's awesome. That's so, and I think we're all so addicted to these threads because they work so well. If you ask any staff member who's had them, I think all of us are just like giddy because you can see how they work right away and you can see how it gets better over time. And I think part of what you're talking about is sort of the ability for them to go into lots of different places and solve a lot of issues that maybe you didn't even know was solvable. So now you're also a national trainer for NovaThreads, is that right? And tell everybody a little bit about what you do when you're doing that.
Yeah, so that's actually one of my passions. I love teaching. I love traveling and just speaking about threads because it's, I don't want to say new, but relatively new to most people's practices. So I love hearing people's feedback. I learn just as much from these procedures because every time I start my procedure, I say, I want it to be fun, comfortable, and safe. Just like I'm speaking to patients. I want it to be fun, comfortable, and safe. So if during these sessions, if a provider says, hey, I've seen it this way, why don't you do it this way? I have to be able to articulate that. And then if they give me feedback, they're like, hey, wouldn't this be a better solution? I learn just as much. So that's why teaching is a passion for me, but then also just learning as well during all these procedures.
Now, if you could ballpark it, could you estimate how many thread lifts you've done?
If we were to average, let's just say 3 a week, which is on the low end, times 52 weeks, times 5 years. So 550 times 3 is 150 times 5 years. 1,500, 2,000 maybe. I'm just making up numbers based on math, but that's not including trainings. So,
and each time now, do people? I guess if people are thinking about, let's say we're doing a little mini facelift with threads. Is that like 3 threads, 5 threads, 20? Like, what is or or does it depend on where you're using them or the person?
Exactly. All those plays a role. And if we go back to that thought process of fillers, right? Are you a person who needs 1 filler, 2 fillers, 3 fillers, 4 fillers, so on and so forth? If you are young, 20 something, and you just need me to lift some heaviness out of the way, then I'll just use a bunch of barbs to lift your skin, approximate skin, or give you a certain trend that you're looking to do, such as the eyebrows, like the eyebrow trend that has recently come through the past couple of years. Now, if you are a 60-year-old patient, I don't want to just lift you. I want to stimulate collagen to make your thin skin much like that 20-year-old skin. That means I need to put in a whole lot more threads. And that's the common question people always ask me is, how many threads am I putting in? And I always respond, well, if you have a fear, do you really want to know how many threads I'm putting in? but it's always a common question. And if I were to put a number, let's just put an arbitrary number, because we say 10 units of Botox for every decade of life, right? I would say it may be close to that. So 10 threads for every decade of life might be a reasonable number.
Got it. So you're telling me I'm 90 in my Botox years? We just did a whole bunch recently and it was like, yay, how many did we do? And she's like, I think 90 or something. But we did this area for the first time. I'd never had the little, neck cords done. So it was like, how did I get from in the 70s to the 90s? Well, we added a whole nother area and I love it. So yeah, but I never heard that. That's really cool.
Yeah, I've never used that analogy either, but if I were to just make up a number for you, it's actually pretty close.
Interesting. Well, I think we could talk about threads all day, honestly. But one of the big questions people have is, how much does it cost? And could you kind of approximate that for us? I'm sure it's super dependent on how many you're using, because every little thread costs a certain amount of money, right? But is there a ballpark range that you sort of work with?
Yeah, it just depends on the area. And again, it really depends on the provider. So when you try it as a consumer, as a customer, let's just say I'm the 5th person in line and I'm giving you a consult. That question of how many threads I use will play a huge role in that. Because those 4 other providers that you had consults with in San Diego, let's just use the normal 40-year-old person. I guarantee you they probably told you 4 to 6 threads and you got a certain price. You come to me, you got a price probably higher than all those other consultations, but I'm probably using 3 to 4 times that amount of threads. So it's one part of it is actually the material of it, how much I'm doing. But more importantly, I'm doing that because I want to give you the best result possible. Also, is the person who's doing it just got trained by me last week, or have they been doing it for 5 years? Yeah. And this goes back to that client, or one of those clients who I had last week. She said she had a consultation. It's actually on the review, I think. I think it's on Yelp or Google. She wrote on the review, had a consultation, but the provider canceled for one reason or another, but that gave her time to research. When that patient researched it and found out this provider has only been doing it for a couple of weeks, she's like, maybe I don't want to go forward with someone who's new to this. Came to us, realized I was a national trainer, been doing this for 5 years and they're all of our rewards. It makes a little more sense. I will never speak to cost when it comes to procedures because money is very important. We work hard for our money, but then also we have one face, one neck, one life. You don't want to risk it. There's so many things that can go wrong. And for the most part, it should be safe and comfortable. But finances plays a role in that.
It does. And I think we just did a financing episode with Janelle, our COO, and she talks about, how in the med spa we use Cherry for financing. And that really helps bridge that gap, because you might think, well, I had $2,500 budgeted, but, Khan's maybe telling me I need $3,500 worth of threads to really get to my goal, or $4,000. Then that helps bridge that gap, and it can make it a really affordable monthly payment, just like you make for your car or anything else, that you're able to sort of get the best result, by using the right amount. But you alluded to something of, what could go wrong? And we never like to think about what could go wrong, but with threads, why is having an expert person who, like yourself, who's done thousands of them and, does it every day? Because what are the things that could go wrong if it's they're put in by somebody who just doesn't have the experience?
Anyone can do a procedure. Can you troubleshoot the procedure? So if something goes wrong, do you know how to fix it? Something goes wrong, do you know how to backtrack? And I'll give 2 examples of this. Patient went to somewhere else, got threads, had a miserable experience, but it was all based on finances. It was probably half, if not a third, cheaper than what we are. But what happens? She got an infection. The provider did not know how to treat what was actually happening. And then after that, did a treatment on top of that to try to fix that issue and made it worse. So the patient ended up with a huge infection, going to urgency care, going to the hospital on 6 weeks of antibiotics. So you can imagine all that money you saved all went towards urgent care, all went towards this huge infection, only in the end for her to come to us to try to figure out what was going on. Number 2, this was another situation. I'll get these emails all the time because providers will know how to do a procedure, but if something goes wrong, if you don't have the expertise, if you haven't had the training for it, if you never encountered it, just because it's a numbers game. The more things you do, the more times you get to practice something. Someone had PDO+threads in their nose. The coordinator sent me the picture and said, hey, the client knows that they probably can't do anything, but they want to get your feedback. And from a liability standpoint, we just have to make sure like, hey, this isn't a consult. Because I'm not seeing you in person, I can say, hey, this potentially is the situation, but you need to go back to your provider to figure out what's going on. So PDO+threads, likely 2 issues. 1, it was infected, and then 2, it was a migration of the thread. And with the migration of the thread, it could be any number of issues. But if that's the case, then generally you have to go in there and try to take it out. But if your provider doesn't have experience and doesn't know how to, or even have let's just say the team to help them out, right? Let's just say if I can't personally do something, at least I can call any 6 surgeons that we have downstairs and be like, hey, I can't get this thread. Do you guys think you can get it? Or is this an infection? Do you guys think it's an infection? So that's the kind of the team effort we have at La Jolla as well. One, we all have national trainers to try to troubleshoot something. But then if we don't know how to do something, we can rely on our fellow colleagues to help us out.
I think that's a huge, huge point, is that, whether the complication is starting to happen or that the issue is starting to happen as that provider is delivering that service, like something is in the wrong plane or gets stuck somewhere, or after, do you have the knowledge and expertise or the people around you to fix it? And, I think that's something that when I read things on Real Self, or you read different articles, or you see things on social media, you could hear, of course, the most extreme of the stories. But, would you say, have you ever seen a complication that you yourself produced and were you able to fix it in a way that everybody was happy in the end?
There's always going to be issues. There's always going to be side effects. Because 1, this is the practice of medicine. Again, a quote taken by Marie, our former CEO. It's not the perfection of medicine. It's not doing medicine. It's the practice of medicine. Because everyone is an individual. Your face is different from my face, or it's different from someone else's face. And then it's fixing it in the appropriate way, right? Mm-hmm. Sometimes what a patient perceives as an issue they want to fix in the moment might cause more harm to them. So as a provider myself, I have to say, hey, I hear you. I understand this is the issue, but if I try to fix it in the moment, these are the potential outcomes that make it worse and may not even fix what you're trying to fix. Sometimes time is the best healer of all time, of everything. So you have to make sure, am I doing something that's appropriate for the patient when it comes to fixing something? But I've never had an issue where it was catastrophic. Let's just say that. Knock on wood. I've never had any issues because I'm very strict when it comes to my treatments, anatomy, and respecting what the patient is. I'll never gung-ho something, be maverick about it. And although threads are new to San Diego, threads are newer to a lot of the people that I treated on, it's been around forever. And I never touched threads until there was enough research behind it, until I learned enough about it before I would ever do it on a patient. I'm rarely the type of person that says, hey, this is the brand new treatment. I want to be the first one to do it because I don't want to be trendy. I want to keep my patients safe. I have a name behind myself. And more importantly, I have a name behind La Jolla that I need to respect and work behind. Just because something's new, just because something's trendy, doesn't mean I need to be the first to do it. So that's where I'm coming from when it comes to procedures.
I think that's a really good approach because in the long term, as we're coming up in our 35th anniversary, that's really been kind of the modus operandi of like, how do we practice medicine is in a really safe way. And you don't have to be cutting edge on everything because it might not be something that is really ultimately beneficial to the patients. You know, there's a lot of technology that we've looked at in the past or other fillers or other, technologies that it's like there's a new machine out every 5 weeks, it's like, oh, there's this and you can, but that doesn't mean it's appropriate. And doesn't mean it's going to help you as a patient. And we could sell you anything, but that doesn't mean it's going to work. And ultimately, to have the reputation we have over so many years that, I think it's better to, like you say, not be a maverick and just kind of, let's just make sure that this is going to be something that you're going to like and, bring you benefit. Have we kind of covered the spectrum of threads? Did we miss anything before we wrap up?
Yeah, I think one of the things I want to address is reading stuff on Google, reading stuff on Real Self. This is where a lot of the negative press comes in. And if it bleeds, it leads, right? So you will only read negative press when it comes to any procedure. Even if Botox fillers, most of the stuff you'll read is all negative. It's just been around for so long that we're more comfortable with it. Now, if a patient or if a practice promises don't go under the knife when you can get a thread lift, likely you should not be going there. If they're promising you surgical results for a thread lift, not accurate. If they're telling you it's completely safe and no harm will come about it, likely you shouldn't go there. Your provider has to be able to explain beginning to end what they're doing, answer all your questions, and be completely honest with you. If it sounds too good to be true, likely it is. If you're paying for 2 units of Botox worth of threads and La Jolla is charging you $100,000, likely there's something going on there. So sometimes too good to be true, but don't let the fear get in the way of appropriate and safe treatments.
That's a golden nugget right there, for sure. And I think the thing is, you are so accessible, and all of our providers are so accessible and very down to earth. And, if you have a question, you're not sure, we don't want you going forward with something if you're still 80% sure, but not 100. And, you guys are so responsive, I think, phone call, email, a second Zoom consult. I mean, to feel that, you're going forward and it's going to be a positive thing. And I think that accessibility is really important for patients.
Yeah, absolutely. You can fool a patient once into paying for something, but in the age of media, Yelp, and everything else, it's going to get out really quickly if we do bad things.
Yeah. Well, thank you, Khanh. This was really fun. I've learned a whole bunch of things that I didn't know before, even though you and I have spoken in the past way back. We did a quarantine with LJC way back during COVID. We talked about threads, and this was 3 years ago.
Yeah.
So it's been fun to kind of reconnect on this topic because we do them so much, and you do so many threads in the practice. And so it was nice to be able to connect with you and go diving into this topic. And I look forward to seeing you again soon. And then if you're in our audience and you're listening and you have a question, put it in the comments. We'll have all the links of things we talked about in the comment section. And, if you love our podcast, give us a review. We would love it. I'd already told you we're review junkies. So with that, it counts for our podcast as well. So we'd love to have you give us a review on Apple Podcasts or Spotify or Good Pods or wherever you listen. So thanks, everybody. And we'll see you next time.
Take a screenshot of this podcast episode with your phone and show it at your consultation or appointment, or mention the promo code PODCAST to receive $25 off any service or product of $50 or more at La Jolla Cosmetic. La Jolla Cosmetic is located just off the I-5 San Diego Freeway in the Ximed building on the Scripps Memorial Hospital campus. To learn more, go to ljcsc.com or follow the team on Instagram at ljcsc. The La Jolla Cosmetic Podcast is a production of The Axis, TheAxis.io.